Canada has lost its measles elimination status. The Public Health Agency of Canada says it was notified of the status change from the Pan American Health Organization due to a large outbreak that began in October of 2024, which has impacted most provinces and territories. Canada has held measles elimination status since 1998. The Public Health Agency of Canada says status can be regained once transmission of the strain involved in the current outbreaks is interrupted for at least 12 months. Well, joining us now with more reaction to this is Dr. Isaac Bogoch, infectious diseases specialist at UHN. We appreciate your time as always, Doctor. This is probably not something you're feeling too positive about today. Tell us your reaction.
Yeah, it's a really sad milestone. Canada is obviously a wonderful country. We have a strong public health network at a federal, provincial, and municipal level. And it's just disappointing to see us lose our measles elimination status. I mean, it's a wake-up call. It's a wake-up call that we need to double down on our efforts to lower barriers to routine childhood immunizations. And it's a wake-up call that we need to appropriately fund public health. And it's a wake-up call that we need to continue to provide credible, science-based, data-driven information to the general public so they can make smart decisions for themselves and for their families.
I'm sure there's a multitude of reasons why we're in this situation. You have a lot of people who missed their vaccination schedules throughout the pandemic. You've had people who have traveled from far and brought it back home to Canada. But then you also have maybe a small portion of the population that were just, quite frankly, vaccine hesitant to get a measles that is proven to be safe. Talk a little bit about that, and where do we go from here?
Yeah, I think you're right. There's lots of different drivers to this, and some of those might include people who have mistrust of public health and the government, fueled through the pandemic and policies throughout the pandemic. Some might have mistrust of public health and science and medicine, fueled through misinformation and disinformation that's amplified in online settings that have real-world negative consequences, such as this. There's probably a component of disruption of public health services throughout the toughest times of the pandemic, and people weren't up to date on their vaccines, especially their routine childhood immunization. So there's lots of different factors that are probably driving this. But the key thing here is we're here, it's a problem, and we need to take it seriously and address it, which means addressing those key drivers. And all of those really point to the direction of lowering barriers to routine childhood immunizations, credible information from senior leadership at a public health and health standpoint, timely access to primary care, and I think the more challenging component would actually be combating misinformation and disinformation. I know we're talking about measles here, but we've seen this applied to other areas well outside of healthcare and public health, which is proving to be a very challenging effort.
Yeah. Besides, obviously our role in the media and getting the word out there and providing the best information, accurate information in terms of, public education, where does the schools, what is their role in this? Because obviously many of these cases are in younger people. What's their role, and how can we improve on making sure that parents know exactly what they need to know and make sure that their kids are up to date on these schedules?
Yeah, I mean, this is an all hands on deck approach. Schools, communities, community leadership, public health, healthcare, government. I mean, everyone should be involved with this. Certainly, we know that there's a heterogeneity in terms of school vaccine policy. Some schools you have to show proof of vaccination. Other areas you might not need to show that. There are ways where people can circumvent that. And I think it's an important conversation to have, especially at a provincial level. What are the rules for the various provinces, and how do we ensure that the children entering the schools really are up to date on the routine childhood immunizations? But I think it's also important to recognize, too, that the vast majority of people in Canada are immune to measles. They're either born at an era where they've had measles infection and recovered, or they've received their 2 doses of measles vaccines when they were a child, which is exquisitely strong in protecting against measles infections. The issue here is that there are pockets in the country that remain under-vaccinated. And so some communities and some areas geographically are under-vaccinated. Measles is the most transmissible virus on the planet. It has a knack for finding unvaccinated individuals or under-vaccinated communities and sadly ripping through those communities, which is exactly what we saw in southwestern Ontario. We need to work to reach these communities, to build trust, to gain trust, to maintain trust, and to lower vaccine barriers to ensure that people take these vaccines up, because we are at risk of having more outbreaks like this in the future.
Dr. Bogoch, always appreciate your time and perspective. Thank you.